Hi, this is Michael Waits, and welcome back to This Month Amplified, December 2024. David Gritz, a managing director and co-founder of InsurTech New York, is with us as always. David, how are you?
I'm doing great. It's good to see you, Michael. I was, almost in your part of the world, just a little bit off.
And there was a non-zero chance actually that I was going to be at InsurTech Insights, but I just could not make it this year. But maybe next year we'll see each other in Hong Kong. I'd love to see you in New York first. I think that makes way more sense, but let's see what we can do. Yeah.
Yeah. Well, no, I'll definitely plan another trip. It was a great time being there.
Yeah, Hong Kong's amazing. Okay, let's do this. We are doing this a little bit early this month. Normally we do it at the end of the month. And really this is because of the shooting of United Healthcare CEO Brian Thompson that occurred in New York this week, last week. I don't remember anymore.
December 4th.
And I just want to say, December 4th. I just want to say, and I think you would agree with this, like, nobody wants this kind of violence. There's no reason for shooting people. We don't want this kind of violence, but there's a lot to talk about here. And for me, right, like I've lived in Asia for 30 something years. I've lived outside my home country, the United States, for like the longest time. So I have to ask first, like, is the healthcare system in the US so broken, right, that people are starting to feel like they have no other recourse? And again, we don't like this. This is unacceptable violence. But is that how people are starting to feel? Like, what's going on with the healthcare system?
Sure. So, we can definitely spend some time on the healthcare system. I also want to talk about, since, I'm in the insurance industry, about executives in the insurance industry. So, starting with the healthcare system. So, compared to the rest of the world from an outcome basis, the US compared to its peers definitely has a lower life expectancy. But I think, to say that that's purely caused by the healthcare system is more like mixing up correlation with causation, because by and large, there's more people with high BMI or frankly that are just massively
Obese,
overweight in the US. Yeah. And, that ultimately is a cause of, early death. So you can't blame it completely on the healthcare system. That being said, the US is more of a sick care system than a healthcare system. And there's a lot of factors at play. So I think the first factor at play is that, ultimately the positive about the US is it's where most healthcare innovation happens. If you think about it, customized medicine to your DNA happens here. The most advanced treatments for cancer or other, very complex diseases happens here. Most drugs are developed here, or at least co-developed between the European companies here in the US. And, our FDA is considered the gold standard for approving a lot of drugs. So that means that the most effective and expensive treatments are available. So the question that comes into society is, who's responsible for paying for those? What's available to the general population, and how that's going to be covered?
Yeah.
So
go ahead.
Ultimately, my perspective is that there's really three different legs to the healthcare system. The first leg is ultimately the individual provider. So this is a doctor, this is a nurse, this is a healthcare professional that's dealing with someone. The second leg to the school is the hospital systems. So this is a hospital, an outpatient facility, a dental office, any organization that exists for the delivery of healthcare. And then third is the health insurance company. So I think the only way that you can understand the US healthcare system is to look at each component part and understand the challenges or the weaknesses with each individual part. And then when you build it back up again, then you can understand where there's a fundamental flaw and, what can be fixed. Mm-hmm. So let's just start with the individual care provider. In the United States, the care providers happen in kind of two different levels. You have the individual doctor, and then you have all the, health alliance people around them, whether it's, nurses or hospital administrators or social workers. And broadly speaking, in the US, it's not very easy to become a doctor. You have to go through undergrad, and then you have to go through, 4 years of medical school.
It's hard. It's long. Yeah.
So it's basically a 12-year process. And, typically in the United States, education is very expensive. So to get through that whole process could, at a minimum cost, 300,000, at a maximum cost, five, six,
$500,000.
700,000. Yeah. And,
Okay.
the US doesn't, give you no interest on those loans. It's typically, if you're getting a loan from the government, 6, 7, 8% interest. So by the time you're
Jesus.
out after, the whole 12-year process, you have that debt plus accrued interest. So you might have, 750,000 to $1 million in debt. So that's one factor. But the other factor, in all markets, you have to think about the economic equation, the supply and demand. And because our essential system of approving new doctors is very restrictive, right? You have to pass your boards, you have to take the MCAT to get into medical school. Medical schools have very low acceptance rates, and it's very expensive. It means that there's just simply not enough doctors, not enough nurses, not enough care providers to meet the demand of all the people that are sick. So when you have a population that's aging, that's getting fatter, that's getting sicker, and you have a supply of doctors that's not increasing to support that. And not only that, but if an improved doctor from another country that may be well respected comes to the US, they can't just wave in. They have to go through a whole process of essentially demonstrating that they're a US approved doctor, which may or may not be appropriate given the level of training and skill that they have. So we can't even really import doctors. So I think from my perspective, everyone can vilify all the different parts of the healthcare system, but the part that I believe kind of needs the most help is the educational part. We need universities and medical centers and training facilities to be more readily available, to accept more supply. And if anything, if we're talking about the issues of student loans, the prioritization of reducing interest rates or supporting student loans should be based off of supply and demand of industries. So in industries like healthcare, where there's not enough people, that's where subsidies should go to helping people with loans, because we need to encourage more doctors, which will drive down healthcare costs for everyone. So that's the number one issue from my perspective in the healthcare system in the US, is availability of doctors, nurses, and other Health Alliance professionals.
Fine. And I want to make a point about living outside the United States, just so people can get a sense. Okay. I live in Thailand. Thailand essentially invented medical tourism. Okay. Why is that significant? It means because every time I look around, another hospital is building another wing so people can fly here from everywhere in the world. And I mean, wealthy people can fly here from everywhere in the world and get the most amazing medical care ever. Yeah. I know because I had an operation here, and I remember when I was wheeled into the operation room, I was just like, oh my God, I felt like I was in the future. There were just like computers everywhere. The equipment was amazing. It was like cleaner than a clean room for, a computer chip. It was just insane. And the care here is so high quality. And also the equipment was all brand new. Again, it just felt like I was being operated on in the future. And I had the same experience when I was in Japan. I didn't have an operation, but I was in the hospital for a little bit. It was just insane. It's not single payer here. But that addresses a different part of this. But I mean, the education system here, and they do send some doctors to be educated in the United States. And I want to say something radical. I agree with you from a supply and demand perspective. I think medical school in the United States should be free. I really believe it should be free. There are so many reasons why it's so expensive. Right. And we know this. The education system in the United States has outperformed, meaning prices for education in the US has way outperformed inflation for the last 25 or 30 years. That's just a fact.
And what's crazy is universities have larger endowments than ever. And if
Don't even start. Harvard, this is not my quote, but somebody said, and I remember reading this, Harvard is a hedge fund with an education system attached to it, with like classes.
Well, just like GW is a real estate company that happens to teach students.
Yeah, exactly. It's the same thing. It is, and again, it's just me, right? But it is insane in the wealthiest country in the world that education is so expensive, and that the endowments are in the almost hundreds of billions of dollars for the
And they're
biggest
not
and best
taxed.
universities. No, it's not taxed at all. It's insanity. And that addresses just the first problem in the medical and the healthcare system in the United States. What's the second issue? What these the hospital systems?
The second issue is the hospitals and the larger providers. And I think there's two different factors that impact this. So the first factor is an overall industry dynamic, which is that there's essentially been an aggregation. So the smaller individual practices, doctors that were off on their own, maybe 3, 5, 7 doctors, it's not really economical for them to survive because the cost of administration and meeting all the regulatory hurdles is so expensive. So they've been being joined up or bought up into much larger organizations that oftentimes are owned by private equity. And when they aggregate into these much larger groups, I mean, the benefit is, you could have all these different doctors be in the same provider group. So you can kind of go to one place and get everything. But the trade-off is ultimately those organizations exist to maximize profits. And, in a part of the industry where your hope is that people get the best care at the best value, but the organizations exist to maximize profit and minimize care, you have things where doctor's appointments are only 15 minutes, and that in order to schedule an appointment, they're going to charge you money if you have to cancel without giving them, 48 hours notice, and that they're going to build the most opaque pricing systems available in order to make it very difficult for you to compare and shop prices. In fact, even though a fair amount of regulation has passed where you can look up prices, most people don't even know how. I have some friends kind of in the pricing part of the space, and I learned every hospital has a spreadsheet called a charge master file, and it's publicly available, except they use dark patterns to hide it on their websites. It's almost impossible to find. And then when you download it, it's one of the largest spreadsheets that you've probably ever dealt with in your life. It has every single procedure. It has minimum prices and maximum prices, which is one way to tell you a price. Here's the minimum price we can charge, and here's the maximum price that we can charge. But we're not going to tell you what we actually charge you, because we're not going to tell you what your insurance pre-negotiated with us, because that's proprietary information that we signed a confidentiality agreement with the insurance companies. So, as the second leg of the stool, I think one of the biggest problems is that you have, private equity or profit seeking large hospital corporate entities that believe the best way to maximize profit is not to be like a software company and have a subscription that no one uses, right? Instead, it's to figure out how people can use them as much as possible and increase the margins and individual unit costs of everything. And the only way to do that is to minimize competition, which is essentially by buying up small practices and eliminating competition, having opaque prices, and ultimately having very extreme practices for collection where, if someone has a difference between what the health insurance pays and what their individual deductible is, they're going to send it immediately within 30 days to collections. And in fact, in the United States, the number one cause of bankruptcy is medical debts. And a lot of people don't even know how to challenge that, which half the time you didn't necessarily approve of the pricing before the procedure. So, based off of a lot of contract law concepts, you didn't necessarily have a valid contract. So you might not be obligated to actually pay the amount that they say that you are obligated to pay them. And in fact, more than half of the time, the medical billing is incorrect. And you have the ability to challenge that. And people are just not educated that you should ask for every time you get a procedure for the detailed line item billing. You need to review everything. And if it's not right, challenge it immediately. And if you challenge the debts, it makes it much harder for them to collect because they can't perfect a debt if it's being challenged. And they also can't go after and wreck your credit score if it's being disputed. So, the bill you get is not the final bill, the bill you get, is negotiable. And if every patient made a negotiation, we would be sitting in a very different place than we are today. Hospitals would have to be transparent because the absolute cost of them negotiating every bill would force it to happen. So in some sense, I'm kind of blaming the patients for not being educated and
Come
not
on, though.
understanding the process. But in
Come
some
on.
sense, ultimately, the hospitals caused this because they made the billing more opaque than any other thing. Like, what other product do you get where you don't know the costs going into it? When they know the costs, they just don't want to tell you.
Right. I mean, it's like going into a restaurant in New York City and just going, how much is the lobster today? And they're like, market price. You're like, okay, I get it, but I'm here today. What's the price today? And they're like, market price.
Yeah. And we'll tell you in a month.
Right. Yeah, exactly. And I'll tell you in a month what it's going to be. And then you're like, okay, I didn't even have the lobster, but you charged me for it anyway. It just, again, okay, before we make some kind of determination, what's the third piece you said? This is the healthcare insurance, right? Health insurance.
So the third piece is the healthcare insurance. And, there's a lot of different ways to look at health insurance. Many countries around the world have single payer. In the US, it's a private payer system. But ultimately, the simplest way to look at it is health insurance in the US is an oligopoly, right? There's not too many health insurance companies that have, all 50 states covered, right? You have the United Healthcare, you have Aetna, CVS, you have, the Blue Crosses, and you have Cigna, Kaiser Permanente. There's not too many other, major players in the market. So just like any other industry that's governed by a monopoly or an oligopoly, ultimately they set prices, and when they have power and when they lobby, those prices are not beneficial to consumers. So the simplest way, just like any other area of insurance, is to solve competition. You need more players in the space. So if you look at property and casualty, where many lines of business, there's no more than 20% market share of any individual player. Prices by and large are relatively reasonable to the level of protection you get. With health insurance, that's not the case. So that's the primary thing. You're dealing with an oligopoly. No one's trying to break up the health insurers and create more competition. If they did, the problem would solve itself. That's the simplest way to look at it. The other way to look at it is that, health insurance structurally is built as a cost plus model. And I think when you understand it's a cost plus model, that explains where most of the problems come in. They have no incentive to lower the cost of healthcare. And in fact, their incentives are aligned with the hospitals to charge you as much as possible, because how it works, and I know this because I've gotten multiple checks back from my previous health insurer, is they're allowed to make a maximum amount of profit. And, for example, in Pennsylvania, they can make, 20% underwriting profit. So the way to make more absolute dollars is to have higher healthcare expenses. So the underwriting profit is larger on a larger amount. This obviously doesn't work in the same way of other industries where regulators look overall at all of the pricing, right? So if health insurers were incentivized to make profit by making people healthier, and they could make money essentially by people not getting care, then of course things would change, and it would be focused on other areas of care. That being said, there is some areas in the spectrum where it's value-based billing and people are getting incentivized, like the hospital systems, by not having people be readmitted. So some of that's changing at some extent, but by and large, healthcare is a cost plus model. So if you expect health insurers to try and innovate to improve what they're doing, it's not going to happen, because their incentive is to do the newest and latest procedures and pay for all of those things so they can make their 20% profit. So until they're not an oligopoly and the way that they're allowed to make money changes, nothing's really going to change significantly.
So let me summarize this and just say it sounds like a nightmare. So on the individual provider side, the doctors and nurses, it sounds like the same thing that's happening in the real estate market in the United States. It's being consolidated and run by private equity, where there's maybe too much of a profit motive. The hospital systems, again, which seems like really opaque. It's like you go in, you don't know, you kind of know what you're going to get, but you don't know what's going to cost you. And it's so complex to try to figure what that is. And then it feels to me like, just based on what you said, there's a little bit of, I wouldn't call it collusion per se, but high cooperation between what's going on in a very oligopolistic health insurance market with those hospital systems and the healthcare providers. And it feels like for consumers or for patients, maybe it does look to them like the system is really broken. And I guess that gets back to what happened in New York. Right. And I don't have probably any more details than the rest of the public does. But I did think that one thing was kind of really interesting. And tell me what you think here. On the 3 bullet casings that were found, right? What did it say? Delay, deny, depose. These are not random words, right? I'm really curious what you think about this. You're in New York. Right. So you must get a feel. There's got to be a palpable feeling about what's going on there. That's the first thing. And I think we should tell people that may or may not know this. I think it was in April of 2020. There was a book written by this guy, Jay Feynman, who's a legal scholar at Rutgers University, which was called Delay, Deny, Defend. Right. Why insurance companies don't pay claims and what you can do about it. So what was written on those bullets to me does not sound coincidental. Again, you talked earlier about coincidence versus causality. In this case, I don't think this is coincidental at all. I'm curious what you think. And I also think it's interesting that the last word was changed from defend, which would be maybe from the health industry's perspective, just delay, just deny, and defend that position, versus this guy going depose. And a deposition is a legal term, right? Which means if you're going to sue me or if I'm going to sue you during discovery, we're going to do depositions. We both need to be deposed. Anyway, I'm just super curious what you think about this. And in the context of all the stuff you've already said, what's the significance of this event? Like, somebody was mad about something, yeah?
Sure. So I guess to go back to the book and like the meaning of it or the concept behind it, like I said, healthcare is a cost plus model, right?
Yep.
So the only way that they feel that they can optimize their economics is, ultimately they can't change their underwriting and their population selection because essentially the government says that you have to cover the entire population. And, a lot of laws have changed where you can't deny people for pre-existing conditions. So if you just think logically from, like a revenue and cost perspective, if you can't change the profitability of every individual customer by differentiating their pricing up front, the only way you can change the economics is by changing the cost part of the equation of what you pay out. So ultimately, it's natural that a health insurer would say, look, we know we have to cover someone with this terrible cancer that had it as a pre-existing condition. The only way that we can change our economics curve is to delay, right? Like pay slower, deny, right? Say no to certain coverages because you didn't follow the processes, or defend, right? Litigate against paying the coverage of those claims. So I just want to make it clear that I think, I don't think it's right that this happens, and socially this is really bad for society. But the reason why it happens is extremely logical. Health insurance companies are just following their economic incentives because they're forced by the government to cover people with pre-existing conditions and not be able to differentiate their prices based off of people other than their age. So this stuff happens, almost due course. It doesn't mean it's right. That being said, right, a lot of what a consumer can do is be aware of all of these different things. The more educated you are about the claims process, the more proactive you are, the better, right? If you have a family member that's an advocate and can help you through this process, that would be really helpful. And I think what I think is the best solution is, InsurTech startups coming around. And, I actually just met a founder trying to solve this problem that can educate people about what is in your coverage. And if you have these certain circumstances in your life, will it be covered or not? A lot of people don't realize, you can get things like cancer insurance coverage for, a few dollars a month to, a few tens of dollars a month. So if you ever have cancer and you have one of these health insurers deny you, you have a supplemental cover that just covers that. You can get hospital indemnity coverage that is exactly what it sounds like. It indemnifies you against the costs of the hospital. And, a lot of people aren't educated on these other products, which can overall fill the gaps that you might have. So some of those are the solution. Understanding, your rights is the solution. But I don't think, shooting at an executive is going to solve the problem. It might create some awareness, right? But at the end of the day, the solution is, advocacy. And, recently I had a firsthand experience. My mom went to the hospital and my parents were actually pretty proactive about it. They, within the hospital system of Philadelphia, that my parents were a part of, Penn Medicine, so University of Pennsylvania Medicine. Yep. They have this program called Penn Passport, which for an annual or a monthly fee, you actually get concierge medicine. So you're assigned to an expert that helps you go through all the different care. They get you admitted into the right places. They bring the right care people for you, and you literally can call them any time of the day to be your advocate. And services like this, concierge medicine, where you can have an advocate, lead to better outcomes. I saw it specifically with my mom, who recently got out of the hospital, and I think because of that, she had a significantly better experience. And in fact, like one of the places that she went to was not great because it wasn't part of the system and wasn't available for the concierge. It was a different hospital, not in that system. So that's one solution. But the other is, InsurTechs that can help educate people about what coverages they have, what coverages they should get, and to help manage the claims process. So I don't think that we're going to solve the major health insurance issues because it's so tied up with government regulation, the way that the products are priced, the way that incentives are created. That being said, the simplest way is literally to create, additional incremental products and services to help people through that process. And our hope as InsurTech New York is to identify those companies, help get them funded, and get them into the broader consciousness of the world that people can use and take advantage of. And if little by little people are educated, those economic incentives will change.
Talk to me about the chatter at least in New York. But I mean, you do run InsurTech New York, but it's less of, what's the right thing to say? You're connected all over the country, right? To people that are in the insurance and the InsurTech space. And I'm curious, like, what the feedback is that you're getting, or what the conversations are that people are having about what happened. And like we said at the beginning, and like you just said, right, the solution to this is not like shooting the executive of UHC, but something like, again, just the statistics that I was looking at says that UHC was the highest denier of claims, the lowest payer of claims in the healthcare industry. Something like 32% of claims are denied. And there's got to be something there where people are so frustrated about it. What's going to have to, and maybe you do want to talk a little bit about executive safety. That was something that you talked about at the beginning, right? And even that guy apparently had a choice to have, like, they have their own private security. And he was like, yeah, I don't need it, even though he'd had some kind of threats against him, according to people that know him, that have spoken about this. I'm just trying to figure out, like, what the health care consumers in the United States are feeling like, and what the conversations are that you're hearing about, like, why this actually happened in the context of all the things you've already pointed out.
So let's break this into two pieces. One, general sentiment of people, and then we can go to, general sentiment of the insurance industry and executive safety. So in terms of general sentiment, I would say, it's probably hard to know from outside of the US, but what's basically happening is, like, there's the current of what happened, and maybe there's some of the fear. But frankly, you would think when, a broad day murder, this happened at 6:30 in the morning in broad daylight, people would be afraid of going to New York City. In fact, no one thinks that at all. They kind of feel or understand that this was a targeted person, and this violence happened almost because it was coming to the guy or the organization, so to speak. Like, he could be replaced with another executive, and they might have targeted the other executive. But ultimately, people in the US, feel a lot of pain. Like almost, I could say probably almost everyone that I know, including, like I said, in the situation with my mom, they've had one or part of their claims denied for a reason that was not explained to them, that was not logical, that didn't seem to align with their understanding of what the policy was and the coverage. And I would say, if this is a 1 in 1 or 1 in 2, where half the population has personally experienced it, people are just unhappy because they feel like what they're being promised, which is a very expensive product, right? Like most families, if you include the employer paid side, are paying, $25,000, $30,000, $40,000 a year. So if you think about that over a 10-year period, this is like $400,000. And to say that most families are consuming $400,000 in medical coverage, yeah, I'm sure some families are, but I can tell you there's many years where, I paid, $10,000, $15,000 and I consumed like $500 in medical care. I might have not even got an annual checkup. So it doesn't feel fair, right? That you're paying so much, you're getting so little. When you actually have a claim, it's a very Byzantine process. Most health insurers, if you want to dispute it, they don't even have an email system. You basically have to like call into a call center and wait 2 hours to talk to someone who's not even in the United States, can't even act. They have to submit a ticket. They're telling you submitting a ticket. And when you get on the phone, it tells you whatever they say is not a representation of coverage because they don't want to be legally liable to what the people in the call center say. So that's, frankly, the company's not being customer oriented because it's an oligopoly and they don't care and they feel like they can collect the money anyways. So the general sentiment in the US is, people might be happy on the micro level that like most of the time they get their doctor paid for, but on the broad sense, they feel like their healthcare is too expensive. It doesn't cover everything that they think it should cover. And when they deal with a major claim, it's a complete nightmare. So people are unhappy. They're posting on social media. I would say this is one of, the most recent murders where like within a few hours, there were already memes about, how this guy had it coming or, silly things about how, he had pre-existing conditions or gunshot wounds are not covered by United Healthcare or whatever it is. And I think at the point where there's satirism, like, and not even a respect for his family, an hour or 30 minutes after it, people are feeling pain and this is how they're expressing it, through comedy. So this is a really serious thing and it's not going to be solved overnight. But I think, if anything, my wish is that this guy didn't die in vain and the global consciousness awareness will lead to, people taking action to, one, be educated, two, just like the whole concept, if you want to change economic policy, you vote with your dollar. If you want to change healthcare policy, you can vote with your dollar, right? If you're a customer of United Healthcare and you don't like them, I understand, obviously, some people you can't change. Like, I'm now a customer because my wife's company uses United Healthcare, but she has the ability to influence. You can call our HR person and say, hey, when we go out to bid for our health insurance, why don't we compare to Blue Cross or Aetna or some of the others? So, every company has the ability to change their healthcare provider by getting a different quote from their benefits broker and making the decision. And maybe the other health insurance is more expensive for the company, but it's better for the employers. You can make that choice. That's one on the employer level. On the individual level, people that choose in the individual markets, assuming that your state has multiple options, you don't have to pick United Healthcare. You can pick a different one. It might be $10 more a month, but it might be better for you in the long run. So you can definitely vote with your dollar. And beyond that, like I said, the more you can be educated with the process of billing, with the claims process, the more that you can challenge it, right? The bill you get is not necessarily the bill that you have to pay. And I remember with one bill I got, I called the hospital and they're like, oh yeah, without any resistance, they're like, we can offer you a 30% discount. If their immediate answer is we can offer you a 30% discount before they even listen to like what I told them about what was incorrect on the billing, that means that you have a lot of power as a consumer. So you got to use that power. So that's one. But then I want to shift before we wrap up and talk about the executive awareness, because I think, perspective that I have and maybe, broader population doesn't happen is when it happened, a lot of people in my, LinkedIn or social network, they post about, hey, they knew this guy and they're really sorry for the family. But, there's some fear that if you're in an industry where one of the executives gets shot, that I don't want to say you're next, but it's possible that it could happen to you, which is a pretty frightening perspective. And I think, it's definitely going to create some change where companies need to think about security. And I think, Michael, you mentioned it, that, this guy had an option for security. And, security for an executive compared to their pay is pretty cheap. It's like, $500 a day. So call it $100,000 a year. For someone that's getting paid, $8 to $10 million a year, it's insignificant compared to his total comp. And, frankly, it shouldn't necessarily be an option for him, especially if he had an employer paying for his life insurance. This should be required. It shouldn't be optional. If you're an executive in an industry that, has negative sentiment against it, the company should require that you have security. Sure, it's a pain in the ass, but at the end of the day, this is an obligation of the company to protect its executives, one, for its own economic interests, but also for the stability of the company to the shareholders. They owe it. Their fiduciary responsibility should be to protect the executives. So that's just table stakes there. But, if you're an individual in the insurance industry, couple tips that I think that should be, somewhat in your radar thinking about things. Number one, don't post on social media your location ahead of where you're going. This guy was going into, a board meeting, right? It's a pretty public thing that a company is having earnings or a board meeting. Don't make it more obvious what hotel you're staying at, what time the meeting's happening. Don't tell people ahead of time. You don't need the public to know. Second is, it mentioned, in all of the information that this happened at 6:30 in the morning. The guy walked by himself, and generally there weren't a lot of other people on the street. So don't broadly walk into open spaces without a lot of other people. Don't go without traveling in a pack, right? If he was traveling in a pack, probably would have been fine. Maybe the shooter wouldn't have gotten a shot. Like, the shooter literally was almost in point blank range. And, be aware of your surroundings. If you think someone's following you, they probably are. Just assume they are. Don't walk in a predictable manner. Don't always walk, in a straight line, the most obvious way to get to a place. And most obviously, if someone puts a threat on your life, even as significant as like an email or a voicemail, take that threat seriously. His wife mentioned that he had threats against his life. That means that you should take it seriously. Even if it's just for that week, you want to get extra protection, do that. And, last thing is, be unpredictable. The less predictable that you are in your movements and your actions and how you do things, the harder it is for the public to, take actions in a way that would threaten your life. So, these are some basic things. Obviously, there's a lot more advanced things that I'm sure a security person could tell you, but these are things that I think any executive in the insurance industry should be following.
Yeah. And to be fair, his house, or one of his summer houses, was also reported that it was swatted, right? Where people would like fake an attack on it. I mean, yeah, it was highly irresponsible, I think, for this guy not to have some kind of security, particularly for a company that would have offered it to him. And I do agree with you. I think it does also point, at least in the specific incident, to just like this anger about what's happening in the entire system. And while, again, we'll say it again, shooting somebody is no way to solve it. The hope really is. And you're right, because I even saw some of the memes out here, and specifically, like, we'd need prior approval to offer our thoughts and prayers. Like, this is terrible stuff. But if it's getting to that point, and if it's getting to there that quickly,
right, the solution is not to vote with violence, because ultimately, the company has a succession plan. The company is the company, and the individual is the individual. The only way to defeat the company is to vote with your dollar. If no one was a United Healthcare customer, the company would have to change, or they wouldn't exist. But, shooting at one executive does not solve anything. If anything, now all the executives will be more protected and the violence won't work anymore. So economics is the only way to solve the problem, and economics in all three levels. supply and demand to have more doctors and healthcare providers, changing the economic incentives. So these mega mergers of healthcare systems and supposed nonprofit healthcare systems are incentivized to keep people healthy, not to care for the sick. And with insurance companies changing the model so it's not cost plus, and insurance companies have the ability, like any other insurance line of business, to optimize through underwriting and optimize through loss control, opposed to maximizing their profits through denying claims, which is now how it's designed, the only way that they can make more money, which frankly is not fair to citizens, but it's something that has to work between citizen advocates, regulators, and the health insurers to all have a conversation on how we can make this better for everyone.
Okay, as usual, let's end there, David. I cannot thank you enough for taking the time to do this. Let's talk again in January, and let's hope that some of these issues that you've addressed here begin to get resolved.
Absolutely.